Hello, everybody. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio. Jeannie White is a producer and writes the blog, which I highly suggest you read for information. I am so excited about my guests today. They are from India, and I know Diwali is next month, so happy Diwali to all our friends who celebrate Diwali. October is Mental Health Awareness Month, but I'm an advocate for mental health awareness every month and every day. And my guests are from the Cactus Communications. I have Andrea Hayward, who is Senior Associate of Global Community Engagement. Hi, Andrea.
Hi, Betsy. Thanks for the lovely introduction, and thanks for having me here today.
You're welcome. Thank you for being here.
Absolutely. So a little bit about what I do at Cactus, and it's great that you brought up that it's Mental Health Awareness Month in October, because what I do is very much related to mental health. So I've been with Cactus for close to 4 years, and most of what I've done has been, what I started with was creating content that would help researchers get published. But what I've been working on for the past 1 year is something that is a lot closer to what I care about. I've been working on a global survey that mainly deals with the mental health and well-being of researchers. And when we started out, we didn't exactly know what to expect. But despite COVID and despite a lot of other difficulties that we faced, over 13,000 researchers from across the globe participated in the survey, and the response was phenomenal. And we got responses from various parts of the world, even responses from countries like Japan and South Korea, where mental health is not necessarily discussed and is a subject of taboo. But
right.
we've recently, so it all went really well, and we worked towards it for a year. And we recently released a comprehensive survey report, which compiles all of our findings and insights that we got from the data that we collected. And it's been received really well. And I would, if some of your listeners are interested in mental health at all, I would definitely recommend that they take a look at the report. It's called the Cactus Mental Health Survey Report. And if you just type that into Google, you should be able to find it easily. But I'm really excited about the potential that this survey report has to actually get people talking about mental health in academia, which is not as common as it should be. And
right.
We're hoping that some of the problems that researchers go through and the challenges that they face, which has been highlighted by the survey, will actually go a long way in bringing to the notice of institutions and universities what they can do to better support their researchers and what they can do to make for a better and a more positive research culture.
Oh, thank you, Andrea. And I'm going to introduce, I hope I pronounced the last name right, Clarinda Cerejo, Senior Director, Thought Leadership of Cactus Communications. Welcome, Clarinda. If I didn't pronounce your last name right, you could pronounce it.
It's perfectly fine, Betsy. Thank you for having me as well. It's a pleasure to be here today. So, I'll talk a little bit about myself and about Cactus. So we actually have a couple of offices. So we have offices all over the world. We're a company that deals with the advancement of science, with accelerating the advancement of science through various services that support research communication. We actually have couple of offices in the U.S. So we have one in Princeton, in New Jersey itself. And yeah, I'm based in India, and I've been at Cactus for very many years, 14 years. So I've seen, the company evolve to sort of cater to different needs of researchers across a spectrum of their needs. And while we primarily deal with research publication, and that includes, offering language editing, publication support, translation services, we also offer medical communication services to pharma and biotech companies. So a lot of it is about the intellectual stuff, the hard stuff that gets research visible and accessible to the world. But we also have an arm that specially thinks about researcher well-being, and so this is one of the initiatives that we undertook this survey. Basically, having worked with researchers for so many years, what we understand is that very few people outside the academic community know anything about researchers, and that researchers are, typically only measured by their publications and the science headlines that regularly make the news, but no one really knows them as people, and they're very rarely even valued as people. And while mental health at the workplace itself has become a global buzzword, and a lot of corporates are really thinking about how to support their employees better and make provisions for better mental health at the workplace, I think that in academia the conversation has been lagging, and this is especially true for countries like those in Asia and Africa, where mental health itself is not spoken about very openly. And certainly in academia, the kind of expectation that there is, which is, there's this term publish or perish, which is commonly used in academia, but the truth is that it's almost literal, and there is immense pressure to publish, and there is no concept of taking a step back, and institutions really thinking about things like researcher well-being, and the fact that to get that kind of productivity from researchers, it's only fair that they're given a supportive environment that can fuel that. So I'm excited to be here and talk to you today, Betsy. Thank you once again for having me.
Oh, you're welcome. I can tell you, Andrea and Clarinda, that here in the U.S., mental health, because of the pandemic of COVID, mental health is finally getting the attention that it should be getting. But it has been taboo here to talk about mental health issues. And, America is a melting pot, so we have cultures, different ethnic groups where it's definitely taboo. They don't talk about mental health issues. And here on my show, I blow the lid off of it, because we need to talk about mental health issues that affects all of us around the globe. This is a global human being issue. And I thank you and Andrea for doing your research and to, talk about what people think is a taboo. Have you found, and by the way, I do love research. I'm very fascinated with research, and I think more research should be done on mental health. Excuse me. Definitely. Have you found in your research, or maybe it started before, you've been doing this for the research for a year, has the pandemic changed in your country, in India, about talking about mental health?
So
whoever wants to go.
I can answer that, and Andrea, then you can comment if you like. So I do think that I am coming across many articles, especially about, especially much more so now about mental health. Interestingly, though, for us, at least for Andrea and me, I think, like she mentioned, we launched this survey, October, so World Mental Health Day of 2019, so literally a year ago. And so we were already on the lookout for conversations about mental health everywhere. And I think that I will agree that that the conversation seems to have amplified considerably with the pandemic, and there's a lot of discussion about things like isolation and pandemic fatigue and all of that. So I think that the crisis is more evident or tangible now, probably. But if I were to think about the academia space, my view, at least, is that it was always really bad, and it's great that the pandemic is, throwing some light on the issue globally. But I just hope that once things get back to normal, we don't regress and mental health is just not paid attention to once again. So, yeah. Andrea?
Yes.
Yeah, I agree with what Clarinda said. And going back to what you said, Betsy, about mental health as a topic generally being taboo in many parts of the world, I think that people hold back while talking about mental health a lot, and I think it's not something that everyone does in a focused way. But even if I look at the survey report and what some of the researchers said about why they wouldn't bring up experiences or feelings of poor mental health, like why they wouldn't want to talk about their experiences of stress or anxiety, I feel like it's very relatable to everyone. Some of the reasons for why they felt like they weren't comfortable talking about this was a fear that it might reflect poorly on them, or a sense that while people would be able to empathize with them, they wouldn't necessarily be able to help, or the fear that they wouldn't be taken seriously. So I feel like it's very relatable because whether or not someone is a researcher involved in academia, I feel like some of these reasons would be very relatable, and it's something that would cross a person's mind given the negative attention that mental health usually gets, and a lot of misconceptions that people have about it. But after COVID-19, I do feel that a lot of people now are opening up slightly and talking about mental health. And I think that because so many people sort of went through this together, the whole sense of it being okay to not be okay sometimes is really come out a lot stronger. And I feel like the acceptance has become more because people have collectively gone through this crisis.
Yes, and Clarinda and Andrea, my feeling is, because I was a caregiver to my husband who had early onset Alzheimer's, I've been speaking about the isolation of caregivers for 3 years. And now I feel the world is getting a taste of what caregivers have faced and will continue to face even after this pandemic is over, is, isolation, how that affects people, and depression because you're isolated, and how that affects people. And, here in the U.S., nursing homes are not allowing visitors. So we are having people with dementia progressing faster because they're not having a human contact. And human contact, as you know, is very, very important. And we were made to connect with each other. And I'm glad in a way, to be grateful for COVID, if anything, it's because it shed a light on what isolation does. And it's not just during COVID. It's every day for some people who are caregivers. And I have, my heart is for the caregivers because I was one. And, I know what it's like. In your research with, you say academia, did you research companies? Did you research professors on how mental health is affecting their ability to do their job?
Yes. So basically, we ran the survey among researchers, and I would like to touch upon what you said about isolation, and I can completely understand your situation and empathize with that. And if I were to extend that analogy to researchers, if you think about it, the fact is that we ran a poll recently on Twitter, and we asked researchers how many of them would say that their friends and family understand the work they do. And a very large majority said not even a chance. And so that itself, sort of can help us understand in some way the isolation that could cause. The fact that if, that you're under immense pressure at work, but there's no one at home or in your friend circle you can talk to about it because they don't really understand your work or they don't understand what it means. And, even things like not being paid very well, which is a very commonly known, it's almost a meme, as it were, the researcher and financial crisis. Things like that, people in a corporate setup would not be able to really relate to because, they are being fairly compensated for the most part. Whereas researchers are, there's this impression that they're driven by passion and they don't, the system does not really lend itself to fair compensation and, things like that. So there is a lot of isolation, I think, that researchers face. And I can completely relate to the example that you gave as well. So how this survey was done, basically Cactus works with researchers, like I mentioned. So we have a lot of researchers in our network, and by researchers I mean people working either in a university or research institution or in industry. So like in biotech or pharma companies or in not-for-profits or in governmental organizations. And essentially these were all individual researchers. They covered all stages of their career. So it involved researchers across the spectrum, not just early career researchers or PhDs, which a lot of other surveys have focused on. We also had quite a few faculty and senior researchers taking the survey. And we had researchers, like Andrea mentioned earlier, across the globe. So over 160 countries, a lot.
Hello?
I think we lost Clarinda.
Okay. Oh, okay. I got you now. That happens. The internet.
Yeah. So maybe I can pick up where Clarinda left off until she can get back here and get a connection again.
Yeah.
Right.
Hi,
so she was.
I have no idea what happened. And I have no idea at what point I got cut off.
Okay. Go ahead. You could continue.
So I don't know exactly where I got cut off, but Andrea, you can complete your thought.
Yeah. So I think that what Clarinda was saying was about what makes this survey unique, and while it's not the first of its kind in the academic space, what really makes it special is the global representation that we were able to get. We had so usually when in the past surveys that have been conducted have either focused on just one group of academics, say PhD students or postdoctoral researchers, whereas in our survey we've been able to cover all academic stages. So we have representation from PhD students and senior researchers, professors, and postdoctoral researchers. And we've also been able to get representation from various minorities in terms of ethnicity and sexual orientation, which a lot of other surveys haven't been able to get. So because of this, we've gotten views and suggestions from a wide range of researchers from across the globe. And some of the results also really reflect these cultural differences. And I feel that an understanding of these differences is important, because when it comes to mental health and well-being, there usually isn't a one-size-fits-all kind of solution. So I feel that some of the results that we've gotten and those nuanced suggestions are really going to help drive change in the right direction.
That sounds great. I'm so glad that your research included minorities, because a lot of times there is disparities in research among minorities, so I'm really glad to hear that. Thank you. Thank you very much for that. I have an idea for research, ladies. I really would like research to be done on children and the effect that stress has on their brain when dealing with a parent or a grandparent who they see suffer from dementia or another type of disorder. You know, what is it like for a child to grow up with a parent who's bipolar and they don't understand why their parent is behaving the way that they are? And it has to affect the child's mental health in some way. And so that's just an idea for research.
That's a really interesting thought, I think. And I don't know if we'll be able to help, but I think that if we share this podcast with our audience of researchers, then you might actually be hitting a researcher in child psychology who might be able to actually take this up.
Mm-hmm. And how do people connect with Cactus Communications? Are you just a research for mental health, or do you provide services also?
Yes, so we do provide a range of services, all oriented towards getting science published and visible. Our website is www.cactusglobal.com, and we have websites in Chinese, Japanese, Korean, English, and a few others, I believe. And you can just type Cactus Communications in Google, and you should be able to find it. You'll be able to find all our contact numbers, email addresses, and a list of our services, which I can briefly touch upon. We
Sure.
offer language editing, publication support, translation services. We also have products and tools, tech-based and AI-based products for researcher productivity and success. We have a community forum called Our Voice, where we invite researchers to come together and discuss mental health mainly. We also have we are also on social media, and you can find us there. We have a brand called Impact Science, through which we help research get more visibility in the public eye. So we help convert technical research into lay summaries, videos, infographics, and more shareable formats that can be accessible to non-researchers. And we have a brand called Cactus Life Sciences that deals with the pharma and biotech segment, and we help medical affairs professionals get their research visible as well.
Very, very impressive. And thank you. Thank you very much. I so appreciate you both coming on. Andrea, would you like to say something that maybe you feel needs to be said that wasn't said?
No, I think we've covered pretty much everything. If I could, I would probably like to share with your podcast subscribers or listeners something that I do in order to take better care of my own mental health, if that's helpful.
Sure.
Yeah, so something that I do, and it's really like a learned behavior because I wouldn't ever do it before, is that when I feel like I just can't when I just can't keep going, when I just can't work anymore, I'm really exhausted physically and mentally, the tendency would always be to just push through and keep going. And I feel like a lot of people do this because we live in such a fast-paced world that even a little bit of slacking off tends to bring on a lot of guilt. So what I've been doing as of late is to just take a break and put what's stressing me out aside. But while I do it, I make sure that it's a completely guilt-free break and that I'm not giving myself grief for taking a break and taking things easy and just being a little more kinder to myself. And it's really helped. And I've seen the difference because after the day when I go back to work, I'm fresher and I'm more productive. So I feel like if this works for someone else, then they should definitely try it out.
Exactly, Andrea. Thank you for that because you're absolutely right. And I have a saying, and I tell this to caregivers because I run a caregivers group online. Self-care, I mean, even if you're not a caregiver, self-care of yourself is literally a matter of life and death. Stress kills people. It's a killer. You need to chill out. You need to relax, meditate, do something to relax yourself and not feel guilty about it. I can completely relate, Andrea. I would take a break and then I would feel guilty. I'm not doing something, especially women, right? Women, we have to be, working at home, at work, and, children, husbands, the list goes on, and we feel like we have to constantly be doing something, and we get stressed. And then what do? We yell at our husbands, yell at our children. That's universal. Doesn't matter where you are in the world, it's universal. And we just need to just take a break. And you're absolutely right. I love that you said that. Clarinda, do you have any closing remarks that you would like, statements that you would like to say that, weren't said?
I have just a message for researchers everywhere, and I don't know how many researchers would be listening to this podcast, but the work you're doing is extremely valuable for the whole world, and I think that it doesn't even matter what the world thinks, because you're just so important. And I think that if you realize how important your contribution is to the world, that's enough. And I think that it's really important for researchers to prioritize their mental health, not be slaves to a culture that just tells them to keep going and keep showing, keep proving, keep having the numbers and non-stop publications, and just focus on the fact that you're doing great work, and take care of yourself, because that's really important, and demand the support that you need from your institutions and from people around you. There are people who care.
Thank you. Thank you very much. I am finding out more and more as I am getting press releases from different places that, mental health is looked down upon. If somebody goes for help, whether you're a professor, a teacher, a policeman, emergency room doctor. Emergency room doctors they have stress every day, and then this COVID gave them more stress. And they are stigmatized for saying, okay, I need help. And it shouldn't be that way. I don't care where you live in the world. It shouldn't be that way. Folks, my show is international, by the way. We all need help at some point in our life. And people shouldn't judge. Don't stigmatize and judge somebody because they say, I need help, I have a problem. Because any one of us at any given time can have a problem and need help. And it's part of life. Life isn't always hunky-dory. And some people need help. And I always say this, Clarinda and Andrea, because I'm not ashamed. I suffered from depression as a child. I am going for grieving counseling. I recommend counseling for everybody. I really do. I'm very pro counseling, go for help, because we need it. We need to take care of our mental health to be better for ourselves, to be better at our job, and to be better to our families. And this is global. This isn't to one specific area in the world. We're all human beings, and we are more alike than we are different. And that's how, I feel. I want to thank you both for coming on. Excuse me. We've had communication problems, folks, in getting the show together, but we got together. So thank you, Clarinda and Andrea, for your patience, and I appreciate you hanging in there. And thank you for your research. Thank you for what you do to bring attention to mental health awareness all over the world, and helping, researchers, and, to be able to say, okay, I'm a researcher, I might have a PhD or whatever degrees, but you know what, I still need my own mental health to be checked on. I still need to relax. I maybe even need to go for counseling, and it's all okay. And this is what I want to tell the world. It's okay to say, I need help. So thank you very much. I appreciate you coming on, and good luck to you with your research. And please do more. Please bring the mental health awareness. Thank you.
Thank you, Betsy, for having us, and
you're
for
welcome.
all the work that you're doing in this space as well. I think it's so needed, and really appreciate that. Thank you.
You're welcome.
I completely agree. Thank you so much, Betsy, for having us and for this
You're
conversation.
You're welcome. Thank you so much, Andrea and Clarinda of Cactus Communications. Folks, check it out. The information will be on the blog And I want to thank Lillian Caldwell, CEO of Passionate World Talk Radio, because she sent me the press release for Cactus Communications and for the radio station, Passionate World Talk Radio, where our mantra is to educate, enlighten, entertain. Folks, if you missed any of this podcast, I suggest you listen to it or listen to it again, and you can hear me on Apple, Google, Amazon Music, and wherever you hear podcasts, you'll hear Chatting with Betsy, and it is free to subscribe. I can't thank these ladies enough. Folks, it's coming up to holiday season. I mean, this is the end of October already. And holiday season brings a lot of stress for people. They don't have a perfect family. Who does? Nobody does. I know the holidays are going to be hard for me because this is my first one without Matt. And you know what? It's okay. I get emotional. It's okay. It's okay to feel however you do. But if it affects you from functioning, please go for help. There are resources. There are resources where you live. Just check on them. Your mental health centers, your senior centers, please call them and see what they have to offer. And I just want to tell everyone, be safe, happy Halloween, and, COVID's on the rise again. Be safe, wear your mask, do social distancing, and just be kind to each other. Until we chat again, this is Betsy Wurzel, host of Chatting with Betsy and Passionate World Talk Radio. Bye-bye now.